Welcome to the module Clostridioides Difficile, the Basics, a Frontline Forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also very relevant for family members caring for a loved one at home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of those individuals. The purpose of this course is to further your learning and build on your current knowledge about Clostridioides difficile, sometimes also called CDI or C. difficile or C. diff. What you know and how you use that information improves the quality and the safety of the patients you care for. This learning module, Clostridioides difficile, the Basics, is the first of a two-part series of modules that explore the important role direct care staff have in both the recognition and the prevention of Clostridioides difficile. You are viewing the first module of the series, which provides a general overview about Clostridioides difficile. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. The objectives of this module include: define Clostridioides difficile, also known as CDI, C. difficile, or C. diff. Review the signs and symptoms of CDI. Describe the risk factors that contribute to the development of CDI. And finally, describe the complications of CDI. CDI is a spore-producing bacteria that causes diarrhea and colitis, which is an inflammation of the large intestine. CDI is highly contagious and is diagnosed by obtaining and analyzing a stool sample. CDI is associated with the use of antibiotics. Patients treated with antibiotics are 7 to 10 times more likely to develop a CDI infection. That is because antibiotics destroy the helpful bacteria in our guts that help keep us healthy. That is why it's so important not to take antibiotics for infections such as colds and other viral illnesses. CDI infections in older adults. Older adults are 10 times more likely to become infected with CDI. In addition, 1 in 11 people over 65 years of age diagnosed with CDI die within 1 month. More than 80% of CDI deaths occur in people aged 65 and older. And finally, older adults that have had a previous CDI infection, a recent hospital or nursing home stay, who have a weakened immune system, or those who've had an organ transplant are at much higher risk of developing CDI. The risk factors associated with CDI. There are several risk factors associated with CDI. These include taking antibiotics, which can destroy helpful bacteria in your intestine, staying in or living in a healthcare facility, such as a hospital or a nursing home, having a serious illness or a medical procedure that might weaken a person's immune system. Women are more likely than men to have a CDI infection, but the exact reasons for that are unknown. Having one CDI infection increases the chances of having another. And Black Americans with CDI experience longer hospital stays, have higher death rates, and are much more prone to moderate or severe CDI illness. Signs and symptoms of CDI. The symptoms of CDI usually begin 5 to 10 days after starting an antibiotic. Individuals may experience a range of symptoms from mild to severe. The mild to moderate symptoms include watery diarrhea, cramping, stomach pain or tenderness, and loss of appetite. The moderate to more severe symptoms include watery diarrhea up to 10 to 15 times per day, dehydration, weight loss, fever, nausea, blood or pus in the stool, kidney failure, increased white blood cell counts, and a rapid heart rate. Complications of CDI. If left untreated or not treated promptly, CDI can result in several life-threatening conditions. These may include dehydration, which leads to a significant decrease in blood pressure and kidney failure, bowel perforation, which is a hole in the large intestine causing a very life-threatening serious infection, and death. Congratulations, you have successfully completed this first module. It is now time to test your knowledge by taking the quiz. Click on the link for the Clostridioides Difficile, the Basics quiz on the Frontline Forces webpage or in the YouTube description below. We've compiled a list of references for further information about Clostridioides difficile. This material was presented by the Superior Health Quality Alliance under contract with the Centers for Medicare and Medicaid Services, or CMS, an agency of the U.S. Department of Health and Human Services.